It's the end of another busy day. You just saw 20, 30 patients, maybe more. Instead of heading home for dinner with your spouse or playing with your kids, you now begin your night job, charting. Charting is critical for patient care, billing, and medical legal liability, but it steals our focus from our patients, eats away at our time with our families, and keeps us up at night. The burden of always having another chart to complete drains all of us. Freed listens, prepares your notes, and writes patient instructions for you. Charting is done before your patient walks out of the room. Wait, because it gets better. Freed learns your style over time. It's AI, just like a human scribe would, except it will never quit on you. Freed is loved by 3,000 plus clinicians from every specialty. It's HIPAA compliant, takes 30 seconds to learn, and costs only $99 a month. You can try Freed for free right now by going to freed.ai, Freed.ai. Listeners of the Physician's Guide to Doctoring can use the code PGD50 for $50 off the first month. Are you adept at resolving conflict? Want to get better? Take a listen. Hey, this is Brad Block, host of the Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Welcome back to the podcast. Super useful topic today. I know they're all useful, but this one is something we could all do better in our professional lives and our personal lives. Conflict resolution. So we've got Martin Stillman on the show. He's a doctor, he's a physician and a lawyer and a mediator. He's a practicing internist at Hennepin County Medical Center in Minneapolis, where he also serves as the Mediation and Conflict Resolution Officer, an assistant director of the Institute of Professional Work Life, an assistant chief for department and faculty affairs within the Department of Medicine. He wears a lot of hats. In his role within the Institute of Professional Work Life, he often utilizes his experience of conflict management and mediation to assist organizations in bringing about necessary changes to promote physician wellness, something we love here. And on top of all that, he's an associate professor of medicine at the University of Minnesota Medical School and teaches about medical error, malpractice, disclosure of unexpected patient outcomes, and risk management aspects of physician-patient relations and communications. So maybe that would be a topic for a separate show. But for today, conflict resolution. So, Dr. Stillman, thanks for being on the show.
Pleasure to be here. Thank you.
So let's just talk about what types of conflict. I think, the introduction, we've established your credibility. Clearly, you're an authority on the topic, so we can dive right into the meat of the interview, which is just like the types of conflicts or disputes that you end up involved in healthcare.
Sure. So, as you mentioned, for the hospital, I'm the mediation and conflict resolution officer. So that's a piece of what I do. I active general internist for 50% of my time. So I see patients on a regular basis and work with resident physicians as well. And this other piece, both within our institution and then now doing some outside consulting work in this area. It's on the provider side. So it doesn't involve patient and provider conflict. We have a patient representative office that's robust and does quite well. And my interest was in this space on the provider side. So a good example would be if you have an emergency department and OBGYN department, and perhaps they disagree on how to triage pregnant patients. And maybe they're not fighting per se, but there's a little bit of disagreement of who should go where and when and that sort of thing. I would get involved with representatives from the department to put together and mediate a process by which they produce a practice agreement. So that would be an example. I've done issues with resource allocation within a hospital when there's conflict there of who should get what credits for works of publication. And when there's conflict there of who should be first author, second, that sort of thing. A lot of communication conflicts between either individuals or groups or an individual and a group.
Like what kind of a group? When you say group, what do you mean?
Yes, sure. Yeah, thank you. Good question. So resident physicians and team of nurses in a unit would be an example where there's something's happening and their communication is not what it could be. And then a lot of resistance to change. So a little bit of change management when there's conflict there. And those are just a flavor, but.
So they put you in charge when they're going to roll out a new EMR?
I get called after it's been out for a number of months.
Throwing their laptop against the wall because they're,
Right. A whole variety of different aspects of that principles of mediation that I learned as a mediator and then became a mediation coach and then applying those to the different situations.
I think you just gave away the answer because it's principles of mediation. Because I was going to ask, is there a process, like a template, a cookbook, an algorithm, like some steps that we could follow? But from what it sounds like guiding principles, but not steps per se.
It's a good question. I originally thought, that it would be a little more do this, then this. And I quickly learned that that's just not the case. A lot of it involves reading a room pretty quickly. I would say grounding principles of behavior, respect, how it's going to be conducted, that is pretty consistent, of setting ground rules for a mediation process. But exactly, so what are we going to do first or second or third, or how's it going to go? That may vary. From the book Getting to Yes, Discovering Interests versus Positions, which was from that book, which I feel is a very effective approach. That's one approach that can work well. So there are certain things that can be more of a go-to than not. But part of what I like about it, Bradley, is each one is a little different and each process. And so that in itself is a challenge. And sometimes you hit the mark, sometimes you don't. But I like that piece.
It's interesting. Like, when you talk to the finance people, they're like, when you've seen one deal, you've seen one deal. Every deal is different. Everything that you approach is different. You've got your N of one, but that doesn't say anything about what the next. So I guess it's the same thing with conflict resolution. Like there's some guiding principles and you can get better at it over time with practice. But each one you have to approach in its own new, fresh way.
I think that's very well said.
Well, thank you. There's talk of like the climate of safety. I've heard that term before, a climate of safety. You want to create like a safe space for people to be able to communicate. How do you create that climate of safety, specifically when there's a power dynamic, right? If it's like resident attending, nurse attending, chairperson, junior attending, could go on and on.
So my approach, and people have different approaches. I believe in being as transparent as possible. And so what that lends itself to in this situation is calling it out. So I may be in a situation, I was just in one outside of our institution where it was a group of nurses and physicians. Right at the beginning, we talked about, let's talk about, there's a power differential here.
Yeah.
How is that going to affect how we talk to each other? I try to create the safe space because when there's something that everyone's thinking about, but no one's saying, I want to say it. I want to get it out there and deal with it right at the beginning. And what I've found is that the participants, when they see that early on, my sense is that they say, okay, here's someone who's paying attention to issues and they're calling it out. In the same way, speaking about this transparency piece, if I will go in a direction and it ends up being, that could have been better, I will call it out. A great example is I was once doing a intervention between a group of nurses and residents. And again, same sort of thing. This was a communication-based conflict that was going on and people were afraid of. Again, it's all hopefully in the advancement of patient care, right? I mean, patient safety and patient care. I mean, that's what's behind all this. And along with that, people like going to work and all those other pieces that come along. But really, effective patient care, when it's not handled well, that's at risk. Anyway, so I thought this would be a case where they talk about, letting the steam out of the kettle. Like, let's have it where people can just share some of their concerns and what's been going on, and then we'll start. And so talked about it, set the ground rules, and we began.
Ground rules. Let's talk about those. What are the ground rules? Is it like one person talks at a time? You don't start talking until this person's finished. Here, I'm going to give you a wooden spoon, and whoever's holding the spoon is the one who talks. What are those rules?
Yeah, so it's not going to be a wooden spoon, but it's going to be that same sort of piece. It's going to be, we talk about what the goal of the session is, or sessions. So do we have an agreement and questions about that? We talk about a milieu of respect. People don't have to agree, because oftentimes if we're already in this situation, there's disagreement. If I'm working from representatives from a department, I'll say to the chairs, give me people who are willing to participate in the process. They don't have to be agreeable people, but they have to agree to the process.
Respect the process. Yeah.
Respect the process. So that's another piece. And then it is a piece that my job is to make sure everyone has a chance to be heard. Okay. But it's not interrupting. It's speaking in a respectful tone. And that if someone is charged, that's okay. And I kind of will sell it. Okay, here's what this is. This is starting to feel a little bit too hot. So I respect your passion for it, but can you try saying that again in a way that is going to be more receptive? And then they'll work on it. It's that sort of piece. So I work in that. And so I let the group start. And so someone started talking, well, I've had trouble with your group for a long time. And I'm like, okay, this is good. This is good. And then it kept escalating. And I sort of like, do I stop it now? Do I not stop it? Do I let it go? And finally, all of a sudden someone said, I would rather not have you as a doctor and be taken care of by someone in the street than come to this clinic. And it was silent. And I looked and I said at the beginning of this that my job is to create a safe space. My goal there was to try to let the steam out. I feel like I let that go too long. I have to be more careful as a mediator. That's my job. I'm going to try to do a better job of letting this sort of people speak what's on their mind and without letting it get too far. And I owned it. And they looked at me and they're like, yeah, that's right. The disagreement between the two and that anger was, shifted to me. I can recover from that because I made a mistake and I owned it.
It's almost like when you talk to your kids and you like own your mistakes. You're like, I'm sorry. I shouldn't have yelled.
Yeah.
Like I got frustrated. I yelled. I shouldn't have. Let me try and do better. I'm going to work on that. Let's talk about this.
That's what this was for me. And it fits more to my style, but I will call out when things are going well. That was exactly what I was hoping for.
Yeah.
As far as express, like, so that sort of thing. But I try to create a safe space by owning disparities when they're there, talking about ground rules. And then if it's shifting in a direction that doesn't feel safe, pause.
So do you break it down like, here are the things that we all agree on. We all agree that these things are true. Here is where we're disagreeing. Do you ever lay it out like that? Or I'm just making stuff up?
No, I would say that there are like sometimes.
Okay.
So I tends to be, so some of the disagreements for resource allocation, sort of whiteboarded. Some of the other things of communication piece, maybe not as much. I may call it out saying, so we're agreeing to this process or something. So I would say there's a good example of that's in the toolkit. And I may pull that out for a certain conflict and the way we're going to address it, but not every time.
What are some common mistakes when trying to resolve conflict that you've seen? Or maybe that you even made on your own journey?
Sure. Making assumptions. Assuming that I'm coming in, I'm better at it now than I was initially. Assuming that I hear about something and, I bet I know what's going on here. Even subconsciously, I may be asking questions that's sort of leading in a way that's trying to get at my assumption. And so that is a mistake. And that's often made before they get to me. And why it's come to my attention, either here or another institution, is people have made assumptions. Backing that up, that can be a mistake of really trying to start fresh. That's a big one.
Okay. Anything else? Things that trip people up when they're trying to resolve conflict.
Sure. So making assumptions. I would say also when they'll be in a discussion or something and they don't realize that they are leaning one way or another. And then you've let someone talk too long. You have given an indication through a facial expression or something like, wow, that's a great point. And the other person, you're not really doing that. There are subtle things. Sometimes I will say after a session, I'll ask for private feedback saying, how did it feel? And then I may get something, it felt like you paid a lot more attention to the other. I say, okay, well, I'll be aware of that. I'm not sure if I did or not, but it means something because that's how you feel. That's another piece. Also, it's that old saying, we have 2 ears for a reason and one mouth, right? We should listen more than we speak. So oftentimes people
but the ear canals are so much smaller than the mouth. It just doesn't work.
That's true.
The diameter, but
it works in stereo. Helping.
You're talking to an ENT here.
Yeah, no, right. So helping people, really try to pause and listen. So there's a technique called mirroring where someone will say something and I'll say, okay, Brad, this is how I feel about something. And the mediator might say, okay, Brad, tell me what you heard of what Marty just said. And then you'll tell me, I heard this, and that may not match. And I'll say, no, not quite. I'm really getting at more of a respect piece or something here that I'm not hearing. So that sort of mirroring technique.
So the two people on either side are supposed to mirror each other, or you're mirroring the mediator?
No. So what happens is, in this case, the mediator will talk about this process where one person or group will say something, and then they'll ask someone from the other group or the other person to say, I'd like you to tell me what you just heard. And then that person says, I heard this. And then they'll go back and say, okay, Marty, is that what you meant to say? And they say, yeah, that's pretty good, or not quite. We say, because I said it, they must totally understand what I meant. And this mirroring technique is an opportunity to say, well, here's what the person heard. Is that what you meant? We may think that we're very clear in how we say things, but how it's received is different. So that would be a specific technique that sometimes I'll use as a mediator to sort of as a check-in, because maybe I'm not hearing the same sort of thing.
I feel like that's what I do daily as a physician. It's like patients describe their symptoms and I'm like, is this what you mean by that? Or is that what you mean by that? It's a lot of clarification. So it's not like something we do all the time anyway. We just have to take it into a different arena.
I like that.
Let's say you've got people who are resistant to change, resistant to the fact that there's even a conflict or a conflict that needs to be addressed, right? Especially with that power dynamic, right? You've got a physician, let's just take the classic, someone who's just nasty in the operating room, right? But they're like, my patients have good outcomes. I'm practicing good medicine. We get everything done. Nobody's getting hurt. So fine, I ruffle some feathers and make some people sad, but they should be tough enough to handle it if they're in the operating room here. This is serious business that we're doing. So they've got their rationale for behaving a certain way, and you're brought in to resolve the conflict. They don't even think there's a conflict. How do you approach someone like that?
So sometimes if it really ventures into the HR space of someone who is creating a hostile work environment, then sometimes it does live in the HR world, and I may get involved, because it matters and it doesn't. If someone is behaving in such a way that is unacceptable, and there are such a thing, then that sometimes goes in a different direction. But let's just say it's not quite that black and white, right? And I may sort of ask them, what is your reflection of why we're here? And so they may say, well, so someone told me. I say, well, would it be surprising to you that so-and-so, that a number of people are concerned about your behavior? Okay. And usually it's not a no, I would have no insight into that. So usually I try to help them see, like, do they have any insight? And just like, how far of a road do I have to travel with this person to have them realize that there's a problem? Now, let's say they say, I don't think it's a problem. I may approach it different ways. To what degree do you care if this person feels, or people feel, that they would rather work with everyone else than you? Frame it in a way, and it's rare that someone truly doesn't care. Is it ever happened? Well, maybe, but most of the time people care and don't want to be that person. And so it's helping them see. And then it's sort of a, why might that be? Are there things that you do that you feel, why might they be saying this? And then you help them on this self-discovery journey, if you will, even if it's in a session, because oftentimes they've been told before, you can't do this, you can't do this. So do I have any way of sort of helping them come to the realization that maybe there's something there? It doesn't always work, but I know that if I'm already called into at that level, it's unlikely the first time this person has heard or had some sort of concern.
So like a respectful and inquisitive way to approach it. It seems similar to like if you're a resident and you see an attending managing a patient a certain way that you think might be not the correct way to do it, but at the same time, you don't know what you don't know. So if you're going to ask that attending, like you're not going to say, oh, that's the wrong way to do it. You're going to say, help me understand why you're doing it that way. I want to learn from you. It seems like almost a very similar approach. You're like, why do you think people are responding this way? Not, you're a dick.
Great. That's a good example, Brad. I mean, of, again, this respective inquiry, as you put it, that is, in general, an effective approach for most people.
Excellent. Yeah. Okay. So tell us about the CRAFT program. CRAFT with a C, like the noun, not the cheese. So conflict resolution and facilitation training. Tell us about that.
It was just very interesting. So when I started this mediation and conflict resolution officer, this position at the hospital, and I had support from executive leaders. And by the way, I'll just take one little brief offshoot because of like, what else have I learned? This was interesting. Early on, I felt a lot of pressure to come back sort of, okay, I solved this problem. I solved that one. And I felt like my showing the success of this position was dependent upon resolving every conflict. And I remember there's one in particular, and it just was not resolvable in the way that I had hoped it would be. And I remember going back to an executive leader, and we were doing our check-in, what happened with issue X and how about Y, and it said, well, I tried my best and there's still an issue of that. And then it was a he, and he said, okay, how about this one? At the time, he knew that everything is not solvable. And that was an important lesson for me. And sometimes sort of pushing for something every time, isn't always the best way to go. But anyway, so I had some success with this program, and then it built up.
I just want to explore that for a second. So then what would you define as success? Because now you're not saying I've solved the problem. It's a successful interaction when?
So it depends on what the problem is. So if it is coming up with a practice agreement, maybe it's not the practice agreement, but they've agreed for sessions to sit down and talk about it. They both think it's a problem. It's some sort of progress towards resolving it is what I would say.
Yeah.
It doesn't have to be the end. We did it. Here's the practice agreement, or here's the resource allocation decision. Here's the this or that. It's a process. Sometimes though, it is they've agreed to a practice agreement by the end of October. In getting back to your question, so we had this success with this program, and then a new senior medical director for the hospital came in, loved the program. And after a while said, I love it, but I can't have the answer be send in Marty every time. That's not boastful. He's just saying we need a different way. It can't be one. So we need don't give people fish. We need to teach people how to fish, basically. And so that led to the development of this conflict resolution and facilitation training program, where I was training and still do put together this program to teach leaders about conflict resolution. And so it involved how to have the difficult conversation, how to discover interests versus positions, how to get across the finish line when there's impasse, these sorts of things. I'm excited about that because then what happened is then other institutions now have learned about this, and it's a whole new avenue to come in and sort of hear of other people's challenges and whatnot and deliver parts of the craft program. So that's how that developed, was this teach people how to fish. And so that's how that developed.
That's great. So do you ever have people that you had embroiled in conflict that then went to the craft program?
Yes, for sure. And part of it, the program is a self-discovery portion. That's part of the program of how do you, as an individual, approach conflict. Do you tend to be an avoider? There was a Thomas Kilmann instrument that's not, again, developed many years ago, but it's a way where people can take a quick self-inventory and say, do they tend to be an avoider, an accommodator, a collaborator? And so helping them self-discover and say, you know what, I tend to be an avoider. And then we talk about, there are times, Brad, where that's really helpful because they're not jumping into it right away, into the fray. They're going to get more information first. They're not always the first person out of the gate to just say, well, God damn it, we should do this or that or whatever.
Yeah.
Right. And so we talk about, so sometimes that serves people well. Well, we also know that if someone's an avoider, that sometimes they're the people who are taking home that Friday conflict and stewing on it all weekend. And they're not sleeping as well. And they know they have to talk to somebody and have the difficult conversation, but they don't want to do it. And I understand that. So anyway, in this case, there are people who have done it. And then they say, you know what? I knew I was hot. I was always trying to go for the win right away, this and that. I can self-reflect. I can see that, and I can try to do better and sort of realize it. And it's not getting rid of it. It's knowing more. When do you call upon avoidance? When is that a good thing? And, when is it good to be a self-completer and that sort of thing? So yes, people have come back, taken some of the training, and then they have insight into, I can see why I was tough to deal with or whatever, or why I was successful in something.
Well, what did you learn about yourself?
I learned about myself, the transparency piece, becoming comfortable with transparency, and sort of was something that was really powerful for me, and realizing that I'm not going to be perfect and that's okay. And that sort of sharing that was, I think, helped me become more effective. So that was a big piece for me, sort of seeing where I think having the difficult conversation, that in particular workshop after doing this, I feel like I'm more effective. Again, same thing. I'm not perfect every time, but I feel like I'm more comfortable now than I used to be, because there are specific approaches to that are a little more like you talked about at the beginning of the podcast of, is there a cookbook way? It's not a cookbook, but there are approaches, like how do you handle that? And so those are a couple reflections I have. And the challenge of the different interactions, something that even if I don't always get it right, it's a challenging piece for me that I gravitate towards. That it's a challenge that I welcome, because it's a self-discovery. I learned something new there. I'm going to try that next time or whatever.
So we're short on time. We've got time for like one more little nugget. So if there's something that either you want to reiterate that we already said in the show that you really want to drive home to the audience, or something that we didn't get to, that little nugget that you want them to leave with, anything else that you'd like to say?
Sure. Thank you. So here's what I'll say. Well, one thing is, if there's more interest in this work and sort of the things that I'm doing, I'm at healthcaremediator.com. And so you can learn more about some of the work that I do.
And that's how I found you, because I was looking for a healthcare mediator. So you're the first to pop up.
That's good. So there's that piece. So I would say one piece that is helpful when someone is really stuck trying to get over and getting a group to make a decision on something, or two individuals, that when it's really, really hard, look at a specified trial period. People are very afraid of making a mistake, and that if they lean in and do something or give in, that it's going to be forever. And what if they made a mistake? When you talk about, okay, I understand that, and maybe it is a mistake, but what if we agree to a 6-month trial of doing it this way, and we will get back at this table and we will look. And if it's as bad a mistake as you feel it is, we all agree we have to reverse it and go a different direction. And so it's just a way to break impasse, because again, there's this fear that it's forever. And so just defining a time period can be very effective when you think that you're really stuck, or maybe you are really stuck, and helping people see, okay, well then let's try it.
That's really interesting, because that reminds me of something. One thing that I talk about on the show is how to manage outpatient visits efficiently. And one of the things that sometimes people get hung up on is the patients won't leave because they want to make sure they haven't missed any questions. So they keep asking questions, and sometimes the same ones, because they don't want the visit to end because they're afraid they're going to miss something. So all you have to do is be like, okay, I'll give you a call in a week. Okay, let's schedule a follow-up in a couple of weeks. This sounds like the same principle. Like, this doesn't have to be the end. This is just what it is for now. We'll approach the subject. Everything that we're talking about is fluid and changeable depending on how it works. Let's just try this now so we can get this piece done and move on, and then we'll find out if it works. Yeah, I think it's like the same where people get stuck.
I love it. And sometimes I will say, I feel like you have all these questions because you're feeling pressure to get it out. I'll get it out there. What if we say, get a follow-up in a month, and whatever you haven't asked? Because I agree with you. That is similar, because they feel like I got to get everything. Just saying, let's set up another time.
So what's that website one more time?
Thank you. So www.healthcaremediator.com. I really appreciate the questions today. I mean, as you can see, I get excited talking about it regularly and really seeing, sort of spreading some of these things. So thank you for having me on and for the excellent questions.
Well, thanks so much for your time and all you do for your patients and your physicians.
Thanks, Brett.
Thanks for listening. I have a favor to ask. You listened to the episode until the end, which means you either fell asleep or you really liked the episode. So please share it, or like it, or comment on a social media post, or write us a 5-star review, something. It would really help me out. And maybe what you learned from this episode can help someone else too. The views expressed in this episode are those of the interviewer and interviewee, and don't represent the views of their employer or even their significant other. Even though the magic of podcasting make it sound like I'm talking directly to you. This is not a doctor-patient relationship, and this is not medical advice, or financial advice, or really any advice. Thanks again for listening to The Physician's Guide to Doctoring.